Hello, thank you so much for visiting the Center for Anxiety and Behavioral Change website. I'm Dr. Jonathan Dalton, and I wanted just to take a few moments and address the very real mental health crisis that our country is facing among children, teens, and young adults. The research is really scary in terms of the number of kids that are suffering in profound ways and how those rates have, in some cases, nearly doubled since the beginning of the pandemic. Our center, like so many other centers locally and across the country, have been overwhelmed with need by the community. Our waiting list right now is extensive and much longer than we would ever want it to be. The needs in the community far exceed any of our ability to fully meet that need right now. So I wanted to address what we're doing about that. One of the things that we are doing is we are looking to shift our model slightly to be able to deliver more group delivered cognitive behavioral therapy. We find, and the research supports, that this intervention is highly effective and in some cases, even more effective than individual services are. I know many parents, when they're calling for services, haven't entertained the idea of group delivered CBT simply because they really weren't informed about it. So I want to take a moment and talk about some of the virtues of that approach and why we're pursuing it to a larger degree now. The number one reason is we can get more kids and teens treatment more quickly. And that's our number one goal right now, is to get more people off the waiting list and into services as quickly as possible. And obviously, treating multiple kids at one time allows us to do that. But more than that, the research shows that one of the great protective factors against mental health, especially among teens, is a sense of connectedness and social support. And in a group delivered model of treatment, not only are they learning the skills and doing the same treatment more or less with exposure based procedures that are in place, but they're also connecting with other individuals who they can intuitively understand and feel understood by. And that sense of connectedness is so critical in terms of helping kids to reduce their level of suffering and struggle. In addition, being in a group allows other people to demonstrate and model what they are doing to improve their skill sets. And so rather than having a psychologist say, this is what you should do, we have another kid say, in many circumstances, well, this is what worked for me and this is what I did. And that really connects with kids in a deeper way than what most individual therapy models would allow for. Having kids and teens, they're very used to being in groups. Classes are obviously in groups, teams are in groups. It's a natural model for them. And we find that kids who really get involved in the group therapy afterwards, even if they're doing group in combination with individual, when we ask them, what did we do that most helped you? By and large, the answer is the group, that hearing other people, watching them get better, they become trailblazers. They helped the more recent additions to the group to learn these skills more quickly and to use them more effectively. So I just want to spend a few minutes just talking about what group delivered CBT is, why we think it's useful, and why we think it is especially useful during this age of pandemic, when the mental health needs have increased so dramatically and the number of providers clearly have not. I hope you found this useful. If you have interest in seeking group delivered CBT services, please speak to our wonderful intake coordinator, Amelia, and she'd be happy to answer any questions about the specifics, because we have multiple groups and we have groups for parents as well. That's all. Thank you again for your time, and I look forward to being able to help you in any way that we can. Thank you.